Hi, I'm Dr. Samuel Mumira, a practicing obstetrician gynecologist working with Park Road Nursing Home and partnering with Ponea Health to discuss with you today on screening. Screening is basically investigating or interrogating otherwise healthy people on whether they could be having illnesses that they are unaware of, and these illnesses can be detrimental when left or diagnosed late. Screening is important. In my case and in my profession in women who are both in the reproductive age, that is all the way from 15 years to 47 years and way beyond to 50, 60 years in their postmenopausal period. So it's important so that when we diagnose these illnesses and we are able to diagnose them early, we are able to intervene early, and in turn our outcome becomes good. So in screening, we are basically looking at normal people who are walking around, not knowing they might be having something or an illness ongoing in them. So you take an otherwise healthy person, you subject them to some tests or some examinations which may tell you whether they may be having an illness or not. When we look at diagnosis comes at times after screening, whereby we've screened you and we suspect you may be having a certain illness. So we carry on diagnostic tests to confirm on whether you have this particular illness that we are thinking about or not. And our screening will basically be done in women of different ages, and the screening will be tailor-made to the different ages the women are. In our case, we recommend screening for women in the reproductive age group. Number 1, that's 15 to 49 years. We also recommend screening for women in the postmenopausal period or after they've had menopause, and this would be anywhere from 48 years to 55 years. We'll categorize women in 2 groups as we prepare them for screening. First group will be women in the reproductive age, that is 15 to 49 years. Then we'll have the second category of women who are in the postmenopausal or perimenopausal period, and this is from 48 years all the way to 55 years. Screening will be tailor-made for these 2 categories of women with regards to the illnesses or disease processes that we think they may have. Screening will be offered to the 2 categories we've spoken about, either biannually, annually, or every 3 to 5 years, depending on the illnesses that are occurring and depending on how often the illnesses occurs, and also will take or factor in if a lady or a woman has ever undergone previous screening procedures, treatments, or examinations, and this will factor in on considering how often screening will be done. But basically screening will either be twice a year, once a year, every 3 years, or every 5 years. Thank you for joining us in this discussion. You can book my services at ponea.com, and we are looking forward to you joining us in the next episode. Thank you.